Be sure to have all of the following items before you begin. Gonal F RFF 75 IU powder vial, pink mixing needle 18 gauge 1.5 inch, gray injection needle 27 gauge 1/2 inch, prefilled syringe labeled Sterile Water for Injection, USP, alcohol swabs, sterile gauze pads, safety container. Wash your hands with soap and water and make sure you are working on a clean, flat surface. Using your thumb, flip the protective plastic cap off the Gonal F RFF vial. Wipe the top of the vial with an alcohol swab. Hold the barrel of the pre-filled syringe of sterile water in one hand. Firmly hold the plastic cap between the thumb and forefinger of the other hand, and with a downward motion, gently snap and pull off the white cap. If the gray cap inside remains, simply remove it. Remove the safety seal cover of the 18 gauge 1.5 inch pink needle. Push the needle onto the pre-filled syringe until it is tightened, being careful to keep the protective needle cap in place. Holding the rubber base of the needle, secure the needle on the tip of the pre-filled syringe and remove the protective needle cap. With a vial of Gonal F RFF powder on a flat surface, insert the needle of the pre-filled syringe straight down through the marked center circle of the rubber stopper. Slowly inject the water into the vial by pushing down on the plunger. Without removing the 18 gauge 1.5 inch pink needle, invert the vial and slowly pull back the needle as far as needed and withdraw the entire contents of the vial into the syringe. Make sure the tip of the needle remains in the solution by slowly backing the needle out of the vial to withdraw as much of the solution as possible. Remove the needle and syringe from the vial. Gently pull the plunger back to allow a small airspace. Carefully recap the needle. Twist and pull off the mixing needle from the syringe and discard in your safety container. Remove the safety seal cover from the 27 gauge 1/2 inch gray needle. Push the needle on the pre-filled syringe until it is tightened, being careful to keep the protective cap in place. Holding the rubber base of the needle, secure the needle on the tip of the pre-filled syringe and carefully remove the needle cap. With a syringe pointing upward, gently tap on the syringe and slowly push the plunger until all of the air bubbles are gone and a drop or two of liquid appear on the tip of the needle. Carefully recap the needle and lay the syringe on a clean, flat surface. The syringe is now filled with a prescribed dose of Gonal F RFF and is ready for administration. Your fertility specialist will have discussed a suitable injection site with you. Clean the recommended injection site with an alcohol swab and let air dry. Uncap the injection syringe. Hold the syringe in one hand the way you would hold a pencil. With the other hand, pinch the skin around the injection site. Insert the entire length of the needle completely straight into the skin at a 90-degree angle. Once the needle is inserted, you may release the pinched skin and push the plunger in a slow, steady motion until all the medication is injected. Gently withdraw the needle and apply pressure to the injection site with a sterile gauze pad. Discard all used syringes and needles in your safety container.